Get started. I'm Isra Hassan, and I am going to be mediating this today. I just wanted to remind everyone that if you have any questions, there will be time at the end. Please put them in the Q&A. We will not be monitoring the chat feature in Zoom. And it is my great pleasure to introduce Dr. Mark Cannon, a distinguished expert in pediatric dentistry with over 40 years of experience. Dr. Cannon is a professor emeritus of the Ann and Robert H. Lurie Children's Hospital and the Department of Otolaryngology, Division of Dentistry at Northwestern University Feinberg School of Medicine. In addition, he is also the adjunct professor of pediatric dentistry at the University of Tennessee. He has been a longtime member of the International Association of Pediatric Dentistry and is a diplomat of the American Board of Pediatric dentistry as well. In addition to founding a large multi-specialty private practice in the suburbs of Chicago, he was the research coordinator of the residency program at Lurie Children's. Dr. Cannon is on the executive board, the former president, and a master fellow of the American Academy of Oral and Systemic Health. Dr. Cannon has shared his expertise through lectures around the globe, presenting at leading institutions, including the University of Athens, UCLA, and the University of Michigan, as well as at international conferences and organizations, including the American Academy of Pediatric Dentistry and the European Association of Pediatric Dentistry. Beyond his professional achievements, Dr. Cannon has been honored by the Karolinska Institute with invitations to the Nobel Forum and the Nobel Assembly. And most of all, Dr. Cannon is the proud father of 5 and a very proud grandfather of 5 beautiful children. Please join me in welcoming Dr. Cannon. Thank you and welcome.
Thank you so very much. Thanks for having me. And by the way, in a few weeks, there'll be 6 grandkids. So, yeah, I have been involved in research and private practice for a long time. And I'm talking to you today about something that is vitally important, literally, and which is the fundamentals of oral and systemic health. And this is something where I could give the same presentation in a month and half the slides will be different. Now, it's odd to me, you can talk to someone in a lay individual who might actually know more about oral and systemic health than many healthcare professionals do. And that's because if you look at all the publications like on CNN, they tell these stories about like Mike Williams, a very sad instance where he died from dental-related abscesses and sepsis. And here you have an NFL football player playing for the Tampa Bay Buccaneers for years, I think making $7 million a year, full insurance for dental care, a team dentist. Obviously, anterior teeth, the front teeth all look great. What happened? A very healthy individual died from dental pathogens. And yet this happens quite a bit. This is not a rare instance at all. It's like people like to pretend. Let's look at just some lay publications for just a minute. Tooth decay is the number one cause, the biggest primary cause for admissions of children in England from the age of 5 to 17. 40% of kids don't have dental care, regular dental care in the UK. It's not just a problem in the United States. It is a worldwide issue of oral disease. What does this oral disease mean? And why do we have all these admissions? And I can tell you from being in private practice every day, seeing children come in pain and abscesses, what does this mean long term? This is why we look at the science, and this is why it matters. We're going to quickly go through a lot of slides. This is chronic diseases in America from the CDC. 6 in 10 adults have chronic disease. 4 in 10 have 2 or more chronic diseases. We've all seen this slide because the CDC wants everyone to see this. We have all these chronic diseases. Hey, by the way, though, they're looking at 20 and 30-year-olds too to get these stats. What are the stats for people who are 65 and above? Why is it so many have chronic disease? Well, if you look at these chronic diseases, there's something in common with a lot of them. So we're going to go into the fundamentals of oral systemic health. We're going to ask the question, does it matter? Why does it matter? Where is the proof? Well, one thing we know we know this actually from the Nobel Assembly 2017, is that the oral microbiome is a gateway microbiome, as is the placental microbiome, as is the nasal microbiome. They're gateway microbiomes. They're extremely essential for the health of the host. But there are connections that are involved too. You have the oral nasal gateway connection, the oral lung axis to look at. We're going to talk about this in detail. The oral placental gateway connection, everyone knows that. All the research done on how the placental microbiome is akin to the oral microbiome of the mom. The oral gut gateway connection, everyone knows about that. But how about the oral gut brain axis? That's something that we should explore more. What is the literature? We're going to start going through the literature, and you'll realize that a lot of these articles are only 1 or 2 years old. So much has been done recently. Leaky gum, the revisited origin of systemic disease. Leaky gum is an analogous to leaky gut. And we know that the microbial biofilms that you have in the mouth can build up for a long time because the gingival sulcus, the sulcus around the teeth, is unique in the body. And the connection of the junctional epithelium to the dentition itself is particularly weak. So people can carry chronic disease, periodontal disease, for decades. It is often treated but never eliminated. It's only being managed in practice. Publications have shown that the human oral microbiome is associated with a number of chronic diseases, either by increase or decrease in certain microbiomes, in certain bacteria. Well, of course, this is something that we've known for a long time, that you can have a decrease in commensals and have a dysbiotic situation. But the dysbiosis of the oral microbiome has been linked or associated with all these other diseases, and some really good research that I'm going to be showing you. Now, oddly, you can take, as I think everyone knows, that you can take a good commensal, a probiotic actually like Streptococcus oralis, and you put it into the lungs. You're going to have a pathogen. What is a probiotic in one area of the body could actually be a pathogen in another area of the body. But you have keystone pathogens, which are pathogens everywhere, and you have keystone probiotics, typically stay probiotics. Now, can the oral bacteria affect the microbiome of the gut? Of course, because the mouth is part of the gut. You know, it's interesting. Jeff Brown over at Lurie Children's, head of pediatric gastroenterology, always say, hey, the gastrointestinal system begins here right at the lip. And I'm sorry, I accidentally hit a board. And so the bacteria of the mouth will feed the rest of the gut. Now, many of the pathogens, like Porphyromonas gingivalis, which you'll hear a lot of, Porphyromonas gingivalis, is they're acid resistant. And in fact, they prefer acid environments. So they will easily transmit through a gut. And it's been shown that the average person with periodontal disease will swallow about 10 billion Porphyromonas gingivalis bacteria per day, which is the opposite of taking a probiotic, right? That's one route. Don't forget, Porphyromonas gingivalis also is transmitted in the bloodstream. And we do know that Porphyromonas gingivalis has been shown in the literature to be in the intestinal wall and to be associated with like Fusobacteria nucleum with colon cancer, and also many other systemic illnesses. From the same article, you see published in Journal Oral Microbiology that you have an indirect pathway, the swallowing of the oral pathogens such as Porphyromonas gingivalis, which can create a dysbiosis, because Porphyromonas gingivalis, like Fusobacteria nucleatum, these main pathogens we're going to be talking about, they're intracellular bacterial pathogens. They go within the cell, and they go within epithelial cells, and in the mouth, they go within the epithelial cells lining your mouth, the gingival epithelial cells, and they break down the tight junctions. They do the same thing with colonocytes and heterocytes. So they do the same thing within the gastric system. They do the same thing with endothelial cells, creating leakage within atherosclerotic plaque. Very interesting concept, because that means it affects the blood-brain barrier also. Now, being intracellular bacterial pathogens, they take rides inside immune cells. So you will find in patients with Alzheimer's, and we'll get to literature on this, you'll find Orchomons gingivalis within microglia cells. So what it does on a general basis is it causes bacteremia, and the bacteremia themselves are a real issue. They have an increase in inflammatory cytokines, which affect every part of the body. And again, with the indirect, by swallowing, you have the impaired gut barrier function. And again, you have an altered gut microbiome. You have an alteration of your immune function from that. It's such a tight connection. They can look at the coding of the tongue itself, and as it changes from day to night and so on, you find adjacent changes to the gut microbiota. Very strong evidence connecting the two. And you've seen this publication about the ectopic colonization. And this ectopic colonization, as many people are aware of the problem with preterm birth, the effect of Orchomons gingivalis with preeclampsia, the effect of Fusobacterium nucleatum with stillbirth, low birth weight babies, all these issues, but also neurological issues and lung disease, heart disease, and colonic cancer. This is showing cause and effect. We can do animal studies. Obviously, you cannot do this with humans, but a one-time oral lavage of Orchomons gingivalis, the pathogenic strain, W83, one time, they did a lavage in these mice. Of course, they had a sham group too. And it changed the gut microbiota. And it changed intestinal permeability. And followed by that, systemic inflammatory changes. So that shows the causal mechanism. Now, this was published almost a decade ago. Since this publication, there's been many others. Let's go back to an old basic. This is one of the things that we first got involved, going back over, 120 years ago, when they first showed the effect of strep viridans with mitral valve endocarditis. We know that oral health affects cardiac health. That's why we have to work together as a team, right? And going back over 10 years ago, this is when I got really involved with the American Academy for Oral and Systemic Health, which was one of the fastest growing academies that included physicians, nurses, dentists, hygienists, all of us working together clinically. In fact, cardiologists are a strong component, being on the board of the American Academy of Oral Systemic Health Executive Board, looking at these overall effects that these periodontal pathogens and endodontic pathogens cause. If you look at the odds ratio, 13.2 of oral viridans streptococci from endodontic infections being connected with the thrombi. These are very interesting figures because they now often will look with a CBCT to find undiagnosed endodontic infections, which are constantly feeding infections into the heart. And so this has become even more important as the evidence builds. Now, back in 2012, the American Heart Association said there was no Class A or B evidence. There was no randomized clinical trials. And of course, there couldn't be. There's no way you could intentionally not treat half of the patients in a study, allowing periodontal disease to progress. That would not be ethical at all. But as time went on, by 2016, they said, hey, there's a lot of increasing evidence of association between periodontal disease and cardiovascular disease. And by 2019, you saw the American College of Cardiology publication that it was tooth loss was associated with a higher risk of cardiovascular disease, making it 4 times more likely. So now, typically, in many institutions, one of the first questions they ask, have you lost any of your teeth due to dental disease? Because the odds ratios for things like cardiovascular disease goes up significantly, and oral cancer and Alzheimer's. Now published in Frontiers in Cardiovascular Medicine in 2021, You see that early diagnosis and treatment of periodontal disease has an impact on cardiovascular disease and may be a value in reducing the complications associated with atherosclerotic cardiovascular events. But their graphic is wrong. You look at the figure from the publication and they show the oral bacteria and they just sit there. You don't see them actually within the artery. You don't see them within the atherosclerotic plaque where they end up being in all studies. So misinterpretation of the data has set us back. This is from, I think, 2021. I can't see because my head's covering this part of the slide. But this was published in Lancet, and it was a study looking at 4 pre-industrial populations. These were mummies they were looking at. And they came to the conclusion, there were 30 authors, but not a dentist, on this, that atherosclerosis could be due to a basic predisposition to the disease. And they said that because they looked at the CBCTs and they saw atherosclerosis. CT. You show these CTs to a dentist, and what they'll say is, I see a lot of rampant periodontal disease. And that's no surprise to us because periodontal disease, the periodontal pathogen, Porphyromonas gingivalis, has been with Homo sapiens since about 32 to 35 KYA. Really increased Mesolithic period, greatly increased during the Neolithic period, starting about 10,000 years ago. So if you go 4,000 years ago, we see a lot of dentistry being done, including bridge work for teeth removed due to periodontal disease happening. So when a dentist looks at these CTs, we see, of course, the calcifications within the carotid, brachiocephalic, subclavian, but we also see some very deep periodontal pockets and missing teeth that were antemortem because rosacea healing that has occurred. So you say, hey, severe periodontal disease was associated with the atherosclerosis. I always say, just go do a PubMed search. It's kind of like one of my things I do. Someone says, I'm like, so just go search on PubMed and see what you find. Well, if you put in oral bacteria, periodontal systemic disease, you end up with 20,657 results. And if you just start looking through all of them, you find articles published in the World Journal of Gastroenterology, Frontiers in Cell and Infectious Microbiology. You find all these articles published on the relationship of periodontal pathogens to overall health. But this one hit home with me. This is done first, one of the groups was out, Turku, Finland, and the University of Turku is a very well-known institution. I've been there, actually, I lectured there a few months ago at Turku in Finland, and they looked at kids that had oral disease, and they followed them up to 27 years, and they were looking at these kids, and they found that as they become young adults, they were the first to show cardiovascular disease. First ones to show atherosclerotic plaque on CIMTs were the kids who had the oral infection. Now that brings home to me because I was the one seeing the kids with all the oral infections, 5, 6, 7 years of age, heck, even 2 years of age, having multiple abscesses. No surprise to everyone is the fact there's a connection between mental health and airway. But there's more connections to be looked at. Of course, obstructive sleep apnea has an effect on mental health, well published. Oral health, however, affects the airway also. The oral microbiome has an effect on the nasal microbiome. The oral microbiome has an effect on gut health, and gut health has an effect on the airway. So we call that a vicious cycle that can occur. Published in Journal of Clinical Medicine, Sleep Disorder Breathing, and Neurocognitive Disorders. I love showing this article because of the statement that obstructive sleep apnea drives pathology in both cardiovascular and cerebrovascular systems. Absolutely. And cardiologists saying this is important because the neurologist just a year ago at Northwestern University said to me, Dr. Lappin, he goes, what's good for the heart is good for the brain. Well, I think we all know good circulation is important for both, and oxygen is important for both. But there's a little bit more of an interplay than we know about. We know that you can do CPAP, you can improve cognitive function in OSA patients, right? There's been studies on that. Cognitive functions improve with CPAP. One of the first things you do with patients with Alzheimer's is you do a sleep study to make sure that there's not sleep apnea, which sadly influences a good part of the population. This is published in Sleep Medicine Reviews about 4 years ago. CPAP treatment may be effective in improving cognition in OSA patients with Alzheimer's disease. A lot of people don't realize that in some small and pilot studies, but still there, studies are ongoing with Jason Way and others, that just simple oral appliance therapy can help reverse cognitive impairment. And this is why working as a team is always so important. Mild cognitive improvement, mild cognitive issues can be improved with sleep appliances. And of course, sleep appliances help a lot during pregnancy onset sleep apnea, another favorite subject of mine. But the oral microbiome affects the lung. This is the oral lung axis we're talking about. This is what you hear about and read about when you see an article on exercise, asthma, and the effect of oral microbiome, oral bacteria in the lungs, and exercise-induced asthma. There is this relationship, like when you sigh, you suck all those oral bacteria into your lungs. What happens if you take pathogens and you study this in a mouse model? And what they find is you can replicate, you can produce COPD, chronic obstructive pulmonary disease, by utilizing periodontal pathogens. Which again, remember, people with periodontal disease, that's like a massive media in there producing tens of billions of these bacteria, which can be inhaled, go through your bloodstream, and ingested. And a nice study where they actually showed all the effects, the inflammatory cells, the bulla formation, and the effects on lung function. And this is just a graphic from the article showing how they managed to induce COPD in these mice. Well, if periodontal disease is important, all these pathogens is important, then apparently oral hygiene should be important, and toothbrushing should have an effect, even having an effect on your lifespan, right? Something plain and simple? Well, actually it does. And why were we surprised, like with COVID-19? Any of us in the research, we weren't surprised when this came out in 2021. You heard about this on the news, because this was on the news quite a bit, that, periodontal disease was associated with COVID complications, including death of up to almost an odds ratio of 9. Remember hearing about this all the time? Increased need for ICU admission, increased need for assisted ventilation, that's over 4.5 odds ratio. And of course, when they did the studies on the sputum, they found periodontal pathogens were in the lungs, because you can see it, especially with ventilation. You'll see the pathogens down into the lungs. Never a good idea. And of course, the meta-analysis that were published afterwards too, showing very similar results. The more severe the periodontal disease, the more severe the complications with COVID-19. No surprise to us in the research, as was this that came out less than a year ago with pneumonia, hospital-acquired pneumonia, and need of mechanical ventilation. This was published in MedPage today, coming from this article in JAMA on hospital-acquired pneumonia, systematic review and meta-analysis. Yeah, daily toothbrushing is associated with lower rates of pneumonia and ICU mortality, but not antibiotics. That should be telling the importance. So we're not going to get into chlorhexidine because that's a bad idea, but we're not going to get into it. So now we have a wonderful experiment going on in the world, which is unintended and kind of sad because we have cultures changing a lot in India and China. Colleagues from China will tell me there's areas where in China and India where oral hygiene is not fully practiced. So you can go in and remove the confounders and you can say, hey, when there's poor oral hygiene, you have an increase in chronic diseases, cardiovascular disease, diabetes, etc. in these groups. And as published in the European Society of Cardiology from Korea, that not just oral hygiene, but how often people even have their teeth cleaned can have an effect on the cardiovascular events. And there's long-term studies coming out of Scandinavia and elsewhere, all showing the same thing, that just professional cleanings, like the work that was done in Japan, again with COVID-19, those who went back to the dental office and had their teeth cleaned were far healthier than those who did not go right back, who avoided their dental appointment. Even if you brush your teeth at night or not, may have an effect on the risk of cardiovascular disease. And this was published in Scientific Reports last year. So it's a simple choice. It's not that hard to understand. The hygiene works. Hygiene works whether you're washing your hands or brushing your teeth. Hygiene works whether or not there's sanitary facilities. Hygiene is the best public health thing we have. Good stewards. My father spent a good part of his life in Africa working with Near East Foundation, putting in wells, water wells. People have clean water to drink. It's life-saving. Hygiene is important. But that was kind of a joke slide because I sure would hope no one would get a toothpaste all over their face like that, because some of the components in toothpaste are kind of like grandfather cloth thin. They're really not the best ingredients. And I'll show you a lot of my research during this presentation. And I'm part of this research group. We have been working on improving toothpaste mouthwashes to make them better from an oral stomach health. And they're actually getting far more effective at preventing disease. And we have some wonderful articles. I could spend all day showing you articles on that. Also on diagnosis. And this is a key thing, that if you look at nitric oxide levels in the saliva, it tells you if that child is going to have cavities or not. It will also tell you if they're going to have periodontal disease. It also will tell you a great association with their C-reactive protein levels, also with their LDL levels, also with insulin resistance. These are all very important things to know. And yet the testing runs you about 50 cents a strip to test the level of nitric oxide in the saliva, because it is related to the level of nitric oxide within the blood. And again, it's a very simple, easy test, but it's temporal. You have to repeat it on a regular basis so you can actually predict when someone will be more prone to oral disease and maybe even systemic disease. And I mentioned insulin resistance. Well, this is a real major issue. You saw what just came out in the news a couple of days ago with the bigger increase in metabolic syndrome in the United States, much greater than they predicted, with the vast majority of Americans in metabolic syndrome by 2050. Very scary data. But again, diabetes is bidirectional with periodontal disease. You make the diabetes worse, the periodontal disease gets worse. If you make the periodontal disease worse, the diabetes gets worse. You can't treat one without the other. And so in dental practices, and the more informed dental practices, they're routinely making sure that A1C has been done. And in one very large group out of California, they have 1,000 offices, Pacific Dental. They're routinely testing all their periodontal patients. They're having a third of them come back positive for diabetes with the A1C test. And almost very rarely do the patient know they have diabetes or they're pre-diabetic. The pre-diabetic levels are very, very high. And that is really important because, again, we have to work together and inform each other. But pre-diabetes itself, this is from last year, is strongly associated with periodontal disease. And in the long-term studies that came out of the National Health Service out of the UK, it was the periodontal disease that preceded as a warning the pre-diabetes. You see the periodontal disease first, often starting in age 17, 18, 19. In fact, by age 30, 35% of Americans have periodontal disease. And by age 60, 65% of Americans have periodontal disease. So you see, there's actually a little lead time with the periodontal disease. And there's a lot of research on the mechanism. The more severe the periodontal disease, the more likely you are to become diabetic, and the more likely there is to have elevated all-cause mortality. How about oral and mental health? I think this is really a very fascinating subject that I've done some research into. First of all, just look at impact of tooth loss. This is a study this is an old one now. This is from 2022. It's really dated, looking at over 100,000 individuals. The number of teeth are related to the risk of the cognitive decline, finding cognitive decline. So that's such an easy question to ask on a health history from the very, very onset before you even look at the patient. How many teeth do you have missing? And then this is published in Frontiers in Neurology last year. Over 350,000 participants follow up to 8.6 years of age, showing an increased risk between tooth loss and Alzheimer's disease and vascular dementia. It's better. This is an analysis of the link between periodontal disease and Alzheimer's disease, a systematic review. Read this. Periodontitis, a baseline, was associated with an increase, six-fold increase in the rate of cognitive decline over a 6-month period. That's pretty impressive. So, yeah, association between periodontal disease and Alzheimer's disease. But this takes it one step further. They showed in their analysis, the metagenomic analysis, Porphyromonas gingivalis, Treponema denticola, associated with the cognitive impairment. They found it in the patients with cognitive impairment, but not the cognitively normal controls. So we have more and more information coming out on this every day, and I bet you I could go find new articles. But because of this research, and this is published in Journal of Prevention of Alzheimer's disease, managing periodontal disease would be an integral part of Alzheimer's prevention and treatment strategies. And in general, some of the original work from the UK studies of the National Health Service showing the very strong correlations between mental health and periodontal disease. And it's real typical to have people say stuff like, well, they have, they have a mental disorder, they're going to have periodontal disease. It's always really bad in people who have mental disorders. A lot of the research is showing the association of the periodontal disease with depression and anxiety. But the periodontal disease might be one of the initiators, because when you have periodontal disease, you will have gut dysbiosis. And with 70-80% of your neurotransmitters being produced in the gastrointestinal system, that has an influence on mental health. So should probiotics. And the theory we have in oral health is that all oral diseases are dysbiotic. We go back to Elie Metchnikoff and his work at the turn of the century, after the last century, the 20th century. And the missing good guys, the people we should have. And so are we there yet? This was published in Frontiers in Cellular Infection and Microbiology. We have these Keystone pathogens, and it doesn't hardly take any at all. 0.01% of the total count can be pathogens, and they lead to disease. And they can change everything in the microbiome. And they can change things within the gut. So we have these keystone pathogens. Well, we probably have keystone probiotics too that are beneficial. And that means, and this is in biofilms microbiome, that we should look at a personalized microbial therapy. So this is why you see in oral health now, we're doing so much in oral testing. We're running, DNA PCR sampling on so many of our patients, and we're not just doing the pathogens anymore. We're looking for the missing probiotics. There's a number of tests we don't have time to talk about. There's a lot of commercial testing out there that's available. Let's go back in history a little bit. I published this in Inside Dentistry in 2011, clinical application of probiotic therapy. I started my research in the microbiome working with Bacteroides melangenicus 25261 back in 1974. And we showed in my presentation I did in 75, 76 that it was affecting the immune system. That one pathogen, which is now Prevotella negligens 25261, has an effect on your immune system. So it made sense to us even back then. In the 1980s, there's a lot of work done by Jeff Hillman and others, Harvard, Forsyth, Sigmund Sokransky, other famous names, on, hey, how do you prevent disease? We'll have the right guys to begin with because you don't have the problem if you do. And I published in Probiotics, Antimicrobial Protein, all the research at that time in 2011 saying we must start working with the microbiome and influencing the microbiome. But I got some blowback, you might say. Some people say we need to see more clinical research. So we did a study that's published, of course, IRB-approved study working out at Children's Hospital. And we utilized a probiotic in 60 kids. We had 2 different probiotics. And we found, we could significantly influence the oral microbiome. Now, at the time, we didn't realize we're influencing the systemic health too, but I'm sure that we did because I later got permission to do a retrospective review. We went back in 3 years later. We found that we had an effect still 3 years later from that 60-day probiotic intervention with an 86% caries reduction rate. Now, let me put this in perspective for those in public health. That was probably $50 worth of probiotics. It prevented, at that time, well over $1,000 worth of dentistry. The return was 20 to 1. The argument I got back is that fluoride in the water actually has a better return. It doesn't matter. This was on top of fluoride. So this is very important. This is something that should be in all public health systems. I argued for it back then. I'm arguing for it today. This is 2019. And I think these things prove my point. You probably saw this published in Lifestyle part of National Geographic that someone dropped a bag of Cheetos in a cave in the New Mexico Carlsbad National Park. And quoting them, it was world-changing to the microbiome of that cave because of all the processed materials in that bag of Cheetos. And I agree, that was a horrible thing, changing that. But can we also look at what we're doing to mankind? I mean, without being corny, Cheetos corny, never mind. Anyway, over 5 million Americans consume more than 8 bags in that year. What did that do to their microbiome? Just wondering. It's not nutrition. There's no nutrition in there at all. A lot of 0%, right? Leading me to more of my research. This was published in Neurosci. We looked at 30 kids from a blue zone in Colombia, 30 kids from the United States who are very healthy, very hard to find them. They could not be on any medication. They had to have a normal BMI. 30 kids with autism. We had a temporal study. We intervened for 60 days in an autism group with a prebiotic, xylitol. Then we intervened for 60 days with an over-the-counter probiotic. Oops, did that again, too fast. And we were looking at what would the changes be, especially comparing the kids in the United States and the kids with autism. to the kids from the blue zone. And they had a big difference in diet. The kids on autism, the kids diagnosed with autism were on a lot more ultra-high processed foods, even though the parents were trying to limit it. The kids who were very healthy in the United States were actually not having much in ultra-high processed foods at all. The parents were very, very careful what they fed their kids. Oddly enough, they were all very healthy too. But we found major changes in the taxa. I can't go over all the details of this, but over 600 some odd taxa were changed in each group. They were changed when we did the intervention. But a key thing, a very important thing, besides all the obvious changes in the genera, you might have an increase in some species of Prevotella, but decrease in other species of Prevotella. Same thing with Streptomyces and so on. Have differences in the group, Streptococci, I meant to say. But one of the bacteria that we found in the kids with autism produced a hydrolase and the amino acid deacetylase that is breaking down GABA. And that was a possibility that these kids, and GABA is very important, gamma aminobutyric acid for normal mammalian brain development. And we're not the only ones who had similar results. You can look at like at least probably a dozen studies now published with improvements in behavior. Now, what happened in my group, if I go back there and just a little bit because I moved forward too quickly, we had 6 kids who were nonverbal or barely verbal in the autism group that became verbal, and social behavior changed, and then 3 additional with a probiotic. And we were very surprised to see that, but at the same time, other studies were coming out showing that. So that was another very important finding. A very common probiotic, Lactobacillus rhodori, was also found in another study to do the same thing. Social functioning improves and so on. That was published just in January. And I'm not that surprised to see more research. This is from Translational Psychiatry last year, that you have an altered oral microbiota in patients with schizophrenia. You can actually utilize the oral microbiome for diagnosis. You have an accuracy in diagnosis of autism of 94% plus, just looking at the oral microbiome. And of course, we mentioned already depression, but there are variation in the oral microbiome that's seeing in depression in young adults. And we're not, again, and this is not surprising, because if you were to look at the gut microbiome, we would find that would be altered also in most of these patients, if not all. So the future, is there hope? Because sadly, on the world stage, ultra-high processed food is getting more and more common. And I think even probably in the United States, every year, ultra-high processed food is increasing, and it has an effect on the microbiome. And I don't have time to call these studies in, but especially the oral microbiome, a lot of the preservatives like calcium propionate you see in bread will affect the oral microbiome. And the gut microbiome also, worked by Derek McCabe and others. Is there hope? Well, yeah, people are becoming more aware of the problems of high processed food, but we now have these narrow spectrum antibiotics being produced. And these are probably, and I'm just guessing, they're not really saying how they're producing them, but probably bacteriocins that are being utilized that can actually target the Keystone pathogen. So I am guessing, and they're very effective. This was just published, and I just think a few months ago. This was published maybe 2 or 3 months ago out of Harvard School of Dental Medicine and the Foresight Center, which is a very important research center. The use of these narrow spectrum antibiotics. I know of a company down in Florida that's producing narrow spectrum from bacteriocins. But to me, and my personal belief here, you could do a lot of the same with probiotics because, again, the bacteriocins are coming from the probiotic bacteria to begin with. And the importance of this is the linkage of Fusobacterium nucleatum to many other things, adverse pregnancy outcomes, Alzheimer's disease, and colorectal cancer. Let's talk about oral health and nasal health. Obviously, the nose and the mouth are right by each other. And this is another one of my favorite publications. Oh, wait, I'm the principal investigator. Sorry, the little humor there. This was published in Microorganisms in July, and I want to thank Matthew Shiplin for all his work he did on this. It was the first full whole genome deep sequencing of the healthy adult nasal microbiome. Now, obviously, being in the Department of Otolaryngology at Northwestern, this was a major concern of mine that we did have a whole genome deep sequencing and COVID came out. And we're like, well, we don't even know what's normal. How can we know what's abnormal? And especially with all the research being produced on nasal vaccines, we would have to know what's normal. A big surprise, multiple surprises. I spent all afternoon talking about the 2,558 taxa. Ask me why 2,558. That's how much we have money and time for. Then we probably could have gone further, as Matthew would have said. But we found some Keystone probiotics. Streptococcus sanguinis, Streptococcus oralis are very active in the nose, Raffia area. Akkermansia mesenteria, I don't know how active it was. It was kind of down the list on the importance. But that nasal microbiome, as you know, responds to the environment. It responds to climate, humidity, temperature, and the nasal cavity is hardwired to the brain to adjust your breathing patterns, humidity, everything. Remember, the nose exists to actually warm the air first so it can be humidified. And within the area of your face right here, if you take your hand, cover your nose and mouth, that area has a specific microbiome. It's a triad microbiome that consists of nasal, oral, and skin. It's a special microniche of bacteria. And this is important for the developing nasal vaccines, which I am so happy to see the development of. Now, why is the nasal microbiome so important? Well, because it is different between those who are healthy and those with asthma and those allergic rhinitis. And this was published about 2 years ago. So if you have a dysbiotic nasal microbiome, you're going to find associated asthma and allergic rhinitis. So having these Keystone probiotics that are shared back and forth between the nose and mouth may be of great importance. And there are shifts that occur in the human nasal microbiota. This is from this year in chronic respiratory diseases. But one of the things that they found is that when you have a more healthy nasal microbiome, you're going to have plant and bee associated bacterial species. Well, I thought that was really funny because we found you also have species of bacteria that cause damage to plants in our nose. So I don't know if the Department of Agriculture ever read our paper, but a key parasitical bacterium that causes destruction of citrus crops in the United States, they wondered how it got from plant to plant, from tree to tree, from orchard to orchard, lives in our nose. So yeah, you could save a lot by just wearing a little nasal mask and have the workers who are actually picking the fruit. I mean, there's so many things that overlap here. And of course, the nasal microbiome has a lot of immunogenic properties and affects how the airway surface liquid works. Oral health and cancer, periodontal cancer, bacteria, you put that in PubMed, 17,926 articles. You see a lot of epidemiological studies. Genco is a very important name from, 2020 and so forth. Systematic reviews, oral and bacterial microbiota and digestive cancer patients. Systematic reviews show that there is an association between the microbiota of patients with and without digestive cancers, and that's why some of the currently FDA-approved testing systems for oral and oral digestive cancer are looking at the oral microbiome, like Cancer Detect oral throat systems. And of course, there's some specifics. You have with colorectal cancer, the problem with Fusobacterium nucleatum, just like Porphyromonas gingivalis, is that they are very strong at influencing the immune system. They are capable of affecting your memory helper T cells. They're very capable of influencing specific immune cells. They have developed that way. That's how they avoid the human immune system in the oral cavity. And they have been strongly associated with colorectal cancer. And Fusobacterium nucleatum, in fact, is associated even with the metastasis of colorectal cancer very strongly, because in all the metastatic colorectal cancer stem cells, you'll find within the cell Fusobacterium nucleatum. And there are specific subspecies that are associated with colorectal cancer specific mortality. So the specific, as you see, the publications are getting more and more authors on them because they're getting more and more detailed within this oral periodontal pathogen. And the overall association of periodontal pathogens to poor overall survival with cancer, disease-free survival, and cancer-specific survival has been published. And I think these being published in the Journal of Medicine is very important for everyone to understand that to treat cancer, you have to make sure that the periodontal disease is also treated because it influences the survival rate. As for oral cancer, the survival rate for oral cancer is only 68%. And the vast majority of people who end up surviving it and end up having their tongues removed, jaws removed, they have a lot of things done to them to horribly influence the quality of life. The thing with periodontal disease and oral cancer, if you have periodontal disease, it roughly doubles your chance of having oral cancer. It doubles the risk. And yet probiotics, and this is utilizing a common probiotic, Lactobacillus salivarius, seems to inhibit the development of oral cancer. It's funny, Lactobacillus salivarius also prevents cavities and periodontal disease, but it seems to inhibit development of oral cancer. So there's probably a crossover in that mechanism right there. And we have the randomized clinical trials. I showed you some of my own research, but yeah, there are randomized clinical trials on the efficacy. Lactobacillus paracasei, Lactobacillus planarum are, again, bacteria not only associated with benefits for their oral health and preventing and treatment of periodontal disease and cavities, also healing post-surgically if you have periodontal surgery. So I'm almost done. I'm running out of time here. But one of the things that is interesting is the effect of prebiotics with cancer. And this is a preprint that is coming out in Nutraceuticals of the effect of xylitol with two different syngeneic cancer cell models that we're doing with mammary carcinoma and also with malignant melanoma. We found that the prebiotic had an effect with a malignant melanoma, but not the breast cancer cell line. So not everything works exactly the same. Obviously, there's an important distinction between the two, but there was significant changes in the metabolomics of the tumors. And we followed it up now. This is coming out in Nutrition and Cancer. The use of xylitol in this malignant melanoma group using an osmotic pump delivered the xylitol. And the xylitol-treated group lived longer. No doubt about it. The tumor volume increase was decreased by about 35%. And the metabolomic analysis revealed that the common dental prebiotic, xylitol, reduced the histamine production and glutathione production within the tumor and potentially having an effect on the host response with reactive oxidative species, which is very important. And now I'm coming to the end. I tried to time it so I have about 5 minutes to do a discussion. And I want to thank my friends I work with at the Developmental Therapeutic Core and the Metabolomic Development Core facility, Dr. Sandel and, of course, Dr. Garita. So I want to thank you all for your kind attention. And if we have got 5 minutes here to talk.
Thank you so much, Dr. Cannon. We do have a couple of questions. Let's see if we can get in a couple here. What is your opinion on the direct-to-consumer microbiome tests?
Oh, they're going to take over. There's going to be so much of that. And this is where AI comes in. Because the new AI systems coming out, utilize online query. Your zip code makes the difference. Of course, your BMI does. How many stairs you have in your house? Do you work from home? What are your sugar exposures? All those make a difference with the odds ratios. And the new AIs, the generative AIs, work off odds ratios. So yes, you can order those, and they're getting better and better and better. Utilizing, I know several companies that are really working at it. And the good thing is that will stimulate the patient to do something, and hopefully they will see their healthcare professional.
Thank you. I think we have time for one more. Do you have any thoughts about current trends where many people are against fluoride in the public water system? I noticed that your article mentioned non-fluoride ingredients in toothpaste that are beneficial. Is there a move among oral health researchers to encourage using preventive ingredients other than fluoride to prevent periodontal disease?
Well, here's, like I mentioned, you can only do so much with fluoride. Like if you look at the UK, fluoride in the water prevented 14% of the decay. Okay, it's not what people think. The ADA was just quoted as saying, fluoride in the water prevents 25% of cavities. Not necessarily true. It's a 25% relative reduction. The actual reduction is 4% in the permanent dentist and 5% in the primary dentist. It's not that fluoride isn't valuable. We need to add to it. Why are we satisfied with an exaggerated 25% reduction? Because it's a relative, reduction. It's like Mark Rosenberg in his lecture, he said at translational oncology or integrative oncology, I guess, at Cleveland Clinic. And there was a statement made that, hey, we've improved our 5-year survival rate by 50%. Yeah, it went from 2% to 3%. So 50% improvement. So that's what they're doing with the fluoride. They're saying, hey, it's a 25%, but it's relative. What we want to do is get it to, we get to 95%. But probiotics can get to 86%. Other studies show 75 to 80%. Let's go ahead and push it all the way. You still get a benefit in public health. So it's not that people are really against fluoride. The problem we have with fluoride boils down to one thing. And there's great research on that. Little kids eating toothpaste. It really boils down to that. And I'm concerned about that because all of us have been concerned because they've done studies showing the high levels of fluoride in the urine of these 4 or 5, 6-year-olds. And even the CDC itself in October of 2019 said that 40% of little children are consuming too much fluoride. So that's easy. Make people read the label where it says not to be used under the age of 6 without supervision. It's on the label of the toothpaste. So that's really our fault as healthcare professionals that not enforcing that. I was really big at making sure that parents brush their kids' teeth and you would use the appropriate amount of toothpaste. That's not always being done. So we go down a rabbit hole there and talk all month.
Well, thank you so much. Yeah, once again, and thank you to everyone for joining us.
Well, thank you so much for having me. I'm really strongly just emphasizing the importance of oral health to systemic health. And I didn't hardly cover anything in the literature when you see there are literally thousands of publications. A lot of them are excellent on the effect of the Keystone pathogens. And hopefully we'll have the Keystone probiotics to offset the dysbiosis.
Thank you. Thanks again.
Thank you again so much. You bet. Bye-bye.